What about the timing of PD-L1 testing? We're used to doing testing for various biomarkers at the time of initial diagnosis, and I think that it may be a barrier if you have a patient who's progressing now with multiple new liver lesions and a new adrenal metastasis to then have to go send them to interventional radiology, wait a few weeks for the result, and potentially not start your second-line therapy choice until a month or more later. I think this was a particular issue when they were trying to look at PD-L1 in relapsed small cell, where a lot of the patients were progressing too fast to act on the results. So is PD-L1 testing likely to be a barrier, particularly in the setting of previously treated and now progressing patients?
So there was data at this meeting suggesting that there's fairly good concordance between initial diagnosis and testing at the time of some of these patients were tested for entry on study. I don't think that is as much a barrier as the initial trials. You couldn't test pleural effusions, you couldn't test FNAs. It had to be core biopsies, and many lung cancer patients are diagnosed off an FNA or a pleural effusion, and so sort
FNA
of
being fine
needle aspirate. Right. And so how do you interpret those results? But if you have an initial biopsy and that's PD-L1 positive, the data seems to suggest that for the most part, that remains even at the time of progression on chemotherapy.
That's certainly important. What's your sense of this, that it's really early or not bother?
I think we have to think about PD-L1 as a biomarker in a different way that we think about EGFR mutations or ALK gene rearrangements. So EGFR mutations and ALK rearrangements we think are present right from the beginning. They're an essential part of the tumour. When we talk about tumour heterogeneity, we describe them as being in the trunk of a branching tree. Mm-hmm. But PD-L1 is potentially a dynamic thing, and I think it's reassuring to see the concordance data that was presented by, I think it was the Genentech group that presented that data between biopsies taken at different times or at different places in the same patient. But we've also seen sections of tumours that have some parts that stain positive for PD-L1 and others that are negative, which does raise concern about how much we can believe one particular result. Mm-hmm. So I think it's, again, an unresolved question.
Again, early days still. There's much more to learn.